King Tolentino, welcome back to my channel. Today, nasa BGC tayo. Ang goal natin is magpa-chiro sa Intercare. Tingnan natin kung maayos nila yung hips ko. Let's go!
The nerves of the low back control the muscles of the body. So what I want to do is I want to check to see how the nerves are communicating by checking to see how the muscles are functioning. So a function test is not strength. I just want to see if you can keep your leg where I put it. So I'm going to put a gentle pressure. All I want for you to do is to equal it so the leg doesn't move.
Okay.
Okay?
Got it.
Hold strong. Hold it. Hold it strong. Perfect. Just like that. Let's do a blush of the muscles. Hold strong. Hold strong. Hold it. Hold strong. Okay. Right here, I'm going to push this direction. Hold strong. Hold strong. Hold strong. Right here. Hold strong. Keep it here. Resist. Resist. Okay.
I'm fine.
Keep it here. Hold strong. Hold strong. Okay, that doesn't work that well. Hold strong. Hold strong. Okay, that one works. Hold strong. Hold it. Hold strong. Okay, that one doesn't work that well. Hold strong. And that one works good. If the muscle doesn't function properly, the joint becomes less stable. It's like loosening a screw. Okay? If enough of them are loose, then over enough period of time, you'll create another injury. Strong. Weak. Reach under. Give that nerve some breath. Hold strong. Resist.
Yeah.
Nice and strong. Okay. Fourth lumbar is what's causing the low back.
Okay.
Now, here's the consequence, right? If the bones come out and puts pressure on a nerve, the nerve can create dysfunction of the muscle. The muscles won't stabilize as well. So one problem over time can create second problems. Keep this leg straight. Raise it up as high as you can. Up, 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 up. Relax. This side over here. Up, up, up. Okay, relax one more time over here. And relax one more time over here. Do you feel which one goes a bit higher?
This one.
Yes, you're right. This is your pelvis, okay? So this hip is elevated. These are both the same bones. This one's higher. Just like a building would sit on the ground, the spine sits on the pelvis. If the foundation is not balanced, you can get leaning, which is what's happening with you. We have this fourth lumbar leaning off to the left, and we have an elevated right hip. So it's not enough to bring it back, you have to also bring this side down. Does that make sense?
Yeah.
Okay. So I want you to move your hips back and forth like you're dancing salsa. 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9. Raise this leg back up as high as you can. Up, up, up. Good. This side over here. Do you feel that this one went higher?
Yep.
Yep. When structure changes, function changes. Okay? So that's what's going on here. Go ahead. I'm going to be putting your body into a specific position that will give me a mechanical advantage. I'm going to take it to tension. We're going to roll you. I'm going to put a corrective pressure. Your job, relax. Okay? You might hear some noise, right? Normal, not painful. Actually feels nice. So go ahead and just relax. I'm going to open up your shoulders a little bit. There we go. There we go. Nice. Okay. Take a breath in. Breathe out. Just like that.
I felt that.
That was good, yeah. Come over here. So that was your fourth lumbar. Now we're going to be doing your elevated right hip. That was a big one. And next will be the thoracics. Take a breath in, chin to chest, breathe out. Beautiful. Holy moly. You're really stiff on the thoracics. Really stiff.
Nakita niyo yun, yung pinalagot ko likod ko. Okay siya. Sana mag-heal na yung lower back ko. Last December, nagpa-chiropractic session ako. Consultation and yung mismong chiropractic session. Inalign yung back ko pero kailangan daw siya ng therapy. Yung therapy niya is package na siya eh. Part na dun yung deep tissue, yung mismong chiropractic session plus physical therapy. Based dun sa sa akin recommended is 10 chiropractic session, 5 physical myotherapy, tas yung deep tissue 5 din, aabot ako ng 47,200,000. So medyo mabigat siya pero kailangan sa back ko. For this session, yung first, hopefully mas mapagaan niya na yung likod ko. Medyo masakit eh. Nahirapan ako mag-edit ng video. Hindi ako makaupo ng matagal. So, let's go!
Let's start. Comfy? So, you had 6 muscles that week. 2 psoas, 2 TFL, and 2 glute max. So we'll start by checking those.
Okay.
So we'll come right here and pull strong. That's a good one. Right here, pull strong. That's a good one. Right here, pull strong. Hold it. That's a good one. Oh, very nice. Pull strong. Excellent. Good. And raise it up. Pull strong. Pull strong. Okay. Not so much that one. Then pull strong. Okay. So those still inhibited. Now, this muscle is the glute max, the largest muscle by volume in the body. Okay. It provides massive support for the pelvis. If the pelvis doesn't have that support, it's like a major screw is loose on the wheel. You'll have more instability. More instability means other muscles tightening to stabilize the wear and tear of the area that's being affected. Okay, so let's move that back. So we can function so that the muscle will provide the support that it gives. Take a breath in. Breathe out. Okay, move your hips back and forth like you're dancing salsa. 2, 3, 4. Okay, so we move this hip down. So stay nice and loose. Take a breath in. Breathe out. Breathe out. Just gonna move you out a little bit. Okay. Breath in. Nice job. Chin to chest. Breathe out. Whew, actually, a little bit stiff. Yeah, no. So this muscle is called the psoas. Have you heard of that? Okay. Do you know what letter it starts with? P. Okay. Hey. No rookie here, huh? So this is the only muscle that connects directly to the disc.
Okay.
When the discs bulge, it puts pressure on the nerves. Okay. So the sitting position, what that muscle does is it flexes the hip. In the sitting position, that muscle is always short. So if it stays short, contracted, and you stand up, it'll pull where it attaches, which is the discs, and that can create a disc injury. Those changes, the repetition keeps it there, right? So I'm happy you feel better. Now, if you don't do that, it'll eventually come back. It's up to you how you want us to help you. But if you consistently keep it there, move it back, strengthen it, don't hurt it, you'll get longer lasting results.
Okay, cool.
Nice, thank you. Yeah.
Doon na yung Chiro session, first therapy session. So yung myotherapy, ang sarap sa lower back. Then yung Chiro, sarap nung pag-twist sa akin. So next time namin is next week na. Guys, so ito na yung second therapy session ko. Scheduled ako for Chiro and PT. Pakita ko sa inyo, hopefully pwede mag-video. Try na ng therapy. Sorry ako, kawis ako.
Sige lang po. Masakit to, sir?
Hindi, masarap yung Pilipin to.
Okay, so usually right or left? Right, tama po ba? Okay.
Yan yung parang pinofocus nila ng rest na yun.
Yeah. So dito, sir, hindi kami ma-machines because so far, with the patients naman po sa progress ng patients namin, manual therapy works the best. Dito kasi masakit ang treatment pero worth it siya. No pain, no gain lang talaga.
10 lang or to 15 minutes.
Yeah, 10 to 15.
Kasi yung exercise mo, mga ganun natin.
ito kasi sir, diba, yung right, may sumasakit, so the left side compensates already. Lalo na kung pagod na or masakit na yung right mo. So automatically, nagko-compensate na yung left mo, meaning it takes over most of the workload.
Nasa mid na ako ng PT. So nag-warm compress, then nag-release yung muscle ko sa back. Ngayon yung mga exercises to strengthen naman yung mga weak muscles.
Okay, so this is your initial positions right now. Next position is your cow position, okay? So for the cow position, sir, reverse naman. Ito ngayon, yung back mo, yan, mag-arc siya, then look here. Okay, so pag ganito naman na ito siya. Masakit sa likod mo, sir?
Walang pain.
Walang pain. Yung kanina, wala din.
Wala.
Okay, sige. 9 and 10. Relax. Okay. Now, last position is your child's pose. Okay, for this one, you have to sit on your heel muna. Sit on your heel. And then outstretch your arms forward. Yan. Okay. Tapos stretch na, pababa pa din. So for your case, sir, since more on ang tightness mo is on the back, diba? We have to balance this out. At the same time, medyo increased yung lordosis mo. Yung sinasabi ko, sir, diba, pag ganyan, nakatayo ako, may normal curve yung likod ko, diba? Ngayon, when you have an increased lordosis, this is just an over-exaggeration, sir, ha? Nakaganyan.
Okay.
Okay, parang sa this, diba? So, this one kasi, sir, imagine mo from here, diba, na naka-normal ako. Medyo ganyan yung distance, kumbaga. Pag overextended ka, lumiliit yung space. This already compresses your back, okay? Which can, of course, trigger your lower back pain. At the same time, yung muscles mo, mas naggaganto sila, nagtatighten, okay? That's why it's very important to address the tightness, and then also we have to focus on core exercises. Kasi, maski hindi tight yung likod mo, sir, kung yung core mo naman, yung sa abdominal sa harap, mahina, ganito pa din yung posture mo. Okay, so we have to balance it out by strengthening sa harap naman. Okay, tapos pag sa likod, more of stabilization and stretching. On your calf, okay, may stretch na. Good. Next one is on your hamstring over here. Okay? Relax lang.
Hindi ako flexible.
Okay, just focus on your breathing, sir, ha? Good. Unti-unti naman po natin. Usually, pag tumataas yan, that means that this is tight. It's pulling on the other side already. Okay, this one's still on your hamstring. Dito naman po siya. So this one, sir, this is your hip circles. Okay? You can do this at home. So in the morning to help you mobilize, okay? It's over here on your inner thighs, papunta sa groin area. Okay. Next is on your pinformis. This one's over here, na-feel siya medyo sa may part na wet, okay?
Ito, mas kaya ko ito.
Okay. This one's is over here, okay? So, kapit lang po sa tadyaan. Okay lang. You need to feel a stretch.
Ito na yung third session ko ng therapy. So, scheduled ako sa Mayo tsaka sa Cairo. Share ko sa inyo experience. Tapos na yung myotherapy. Grabe, worst pain. Para akong tinorture. Sakit. Pero masarap siya. Masakit na masarap. So, kinabitan na naman ako ng bagong tape.
Alright, come on, face down for me. How was the PT?
That was the worst pain ever.
Okay, well, you know, what we call that is productive pain. So you get to decide when you feel it so it doesn't surprise you later. And it was done, it's over with, and we get the advantage of having the muscle work done. So we get those benefits. Yeah. Take a breath in. Breathe out. Oops. Move your hips back and forth. 2, 10. Yeah. Bones are passive.
Yep.
Bones just sit there, right? Muscles attach the bones and move the bones around. So part of keeping the alignment is to take the structure that moves it and create a new memory so it keeps it in alignment. Because otherwise bones just obey whatever the tone of the muscles are around it. So, so the retraining is the long-term result that could be brought to you. Breath in. Great job. So just keep moving it back into alignment and not hurting it. There we go. A little crunchy.
Yep.
Chin to chest. Good. Breathe out. Actually, your thoracics are so tight. It moved that time before Liz moved
Yes.
well, but let's keep chipping away at that. This may or may not make a noise. So Brian, that's the guy. When he does myo, we have a nickname for it. We call it Brio. It's its own brand, its own intensity. Some patients love it. Other patients are like forbidden. But if you can handle it, it's very good. And it gets the job done.
That's the third session of the Chiro. So, fourth session ko na. Scheduled ako ng PT tsaka ng Chiro. Medyo sore pa yung muscles ko galing sa Mayo nung last time. So, ngayon, ewan ko kung makakaya ko pagka nag-decompress pa sila ng muscle.
So you have two kinds of tissue, red and white. Red has blood.
Okay.
Examples, the muscle, the skin. That will heal faster. 2 weeks, 4 weeks, 6 weeks. White tissue, no blood. Examples, the disc, ligaments, cartilage, right? That heals slower. 6 months, 9 months, 12 months. So coming in and keeping it in position, the structure that will heal first is the red tissue. That's the muscle, that's all that. Once that's supported, then the white tissue will be remodeled over time.
Okay.
So the focus right now is that red tissue. Let's get it nice and strong. That'll provide the support for the white tissue over time to remodel. So, you ready to go?
Yep.
Okay, come on down. Yes, please. Take a breath in. Breathe out. Breathe out. Over here. Great job. Breath in. Chin and chest. Breathe out. Now, which shoulder's bothering you? Both
Here.
sides? Okay. Yeah. I want you to slide down for me this way. Yeah, just hold. Perfect. Yeah, perfect. That's exactly what I want you. Right here. So I wanted your shoulder on this pad and put your hand like this.
Okay.
A little bit deeper. Thank you. And just keep this soft. Keep it soft.
Soft.
Yeah. I'll just work around. Breath in. Breathe out. There we go. All right. Good job.
Thank you.
Take care. Good to see you, man. Peace out.
Guys, right now yung Chiro yung nauna, sarap. Then, scheduled na yung PT naman. So, mag-start na yung PT namin. Kaso bawal mag-video. So, update ko na lang kayo after. Done na yung fourth session. So, sarap. Grabe. Torture ulit. Worst pain pero para sa ikabubuti ng katawan. Guys, now is ano naman tayo, Mayo and Chiro.
Boom.
Face down.
Face down. Yep. Take a breath in. Breathe out. Raise this leg up. Nice. Okay. And then compare this side. Okay. So we're going to cross this one over. Face me this side, please. Good. And then this over here. Okay. Very good. And take a breath in. Good. Good. Take a breath in. Very good. Face up, chin and chest. And breathe out. Your thoracics are always so tight.
Feel tight?
They usually are. That's just what you got. Actually, this one still got a little bit.
Thank you, Doc.
Hi, my pleasure, yes.
So So guys, Mayo na tayo. Yung Chiro tapos na. Sarap. Sabi nila focus naman daw yung upper back naman. Sobrang tight daw kasi. Guys, warm compress muna. Tapos myotherapy na.
Mas marang dito sa left side, sir? Or parang...
Ayun ako may pinipindot ko may parang
Yeah.
malagot ako. Yan ang mas problem ko sa dito. Ayun, ang dami no. Parang nakupo ka lagi.
Tingin ko nga, sir, kasi nakaano yung back niya. So,
Okay.
inhale tayo, sir, ha, sa tabi. So, inhale. Exhale. Inhale. Exhale.
Done na yung myotherapy sa upper back. First time siya. Ayan. Sobrang rounded shoulders na raw ako. Yan, hopefully kahit sa posture. So excited na ako doon sa Mayo. Hindi ko alam kung upper back yung gagawin sa akin ngayon. Yan.
Take a breath in. Good. Good. Nice job. Wow. Raise this leg up as high as you can. Good. And this side. Oh, okay, one more time this side. Okay, one more time this side. Okay. Face me over here, please. Okay, and on this side. Oh, okay, one more time this side. Nice, that goes higher. Very good. Go face me on this side. Structure and function are intimately cannot separate the two. When structure changes, function changes. Take a breath in. Breathe out. Nice. Good job. Over here. Take a breath in. Yeah. Good. Wow. Nice job. Face up. Good.
Thank you!
Yes. Good stuff, man. Keep it up. You're doing great.
Guys, so done na yung Chiro. Sabi nila PT daw ako ngayon. So, hala ko Mayo. Guys, done na yung hot compress. So, strike na ng PT.
Kasi nag-curve na naman yung back mo, yung dito. Kasi kung talagang ito, nakuha mo sa habitual, ano kasi sir, ito eh. Tsaka yung sa pag-upo, nagko-compensate. Tapos yung sa, kung tight yung legs mo, which is tight nga, di ba? Ano nag-stretch tayo. It also tends to pull on your lower back. So talagang mas mag-i-increase ang arc. So kailangan mo i-counteract lahat ng activities that promote excessive arcing on your back. This is part of your G meds, sir, so your gluteus medius. This muscle, sir, is more for the abduction ng hip mo. Meaning yung movement na palabas, yung going to the side. Yun. Try to lift your hip. Masakit?
Wala.
Down. Kabila. Masakit?
Wala.
There. Tapos ito, huwag mo siyang mataas.
Huwag masyadong mataas.
Dapat yung pelvis mo pantay.
Okay.
There. Hold. Again, opposite.
Guys, so done na yung 5th session ko yata ng Chiro and PT ngayon. So, ang ginawa is yung may hot compress, release, stretching, tsaka exercise. Grabe na ni-release yung dito. Nagulat ako yung dito. Sobrang sakit. Buti hindi na video. Namilipit ako sa sakit eh. So, it's my 6th session na sa Intercare. So, now scheduled ako sa Chiro and Mayo. Tapos na yung warm compress. So, mag-start na tayo ng myotherapy. Pakita ko siya sa inyo. Yan, Mayo nga pala. Yung meaning ng Mayo is muscle. So, muscle therapy siya. Specialized dun sa problematic area.
Nakaka-feel namin yung mga trigger points. So, yun, tinatry namin, sinusubukan namin yung bawat nodules. Kasi sa nodules kasi napupunta yung trigger point. So, pag pinapress namin yun, merong dalawang reaction kami nahanap. Yung isa, latent, hindi active yung trigger point. Pero meron yung isa, pagka na-press namin, na-feel namin nag-guard yung mga surrounding muscles. Ibig sabihin, may spot yun, or active, maybe active yung trigger point.
Okay.
So, pagka gano'n, yun yung mga pinatarget namin.
Guys, ito na yung myotherapy. So, iti-tape naman to yung neck ko para sa support.
Good to see you. All right, good to see you. You breath in.
Wow. Wow.
Nice job. Face up. Ooh, man, that's your thoracics are always so stiff. Wow. Great job.
Thank you very much.
Take care. Yes. See ya. Peace out. Yeah. We'll see you Tuesday. Bye-bye.
And we're back here sa Intercare BGC. So, scheduled ako ng PT tsaka Chiro. So, kasama ko si Wine. Hopefully, makapag-video ako. Problem ko ngayon is medyo na-injured ko yata ulit yung sarili ko. Medyo masakit yung hips ko, payoko. Yan, hindi ako gano'ng makagalaw. PT muna tayo. Yan, so hot compress muna tayo. Guys, ito na yung hot compress. Start na ng PT namin.
Do you feel any pain or tenderness here po? Sarap. Masarap po. Makakalambot ng sarap. Sir, do you feel any pain or tenderness?
Walang pain.
Wala po. Even here, sir?
Wala.
Wala. That's good po.
Pero yung pag may napipindot ka ba na dito, nararamdaman ko sa loob.
May tenderness po?
Baka yun yung sinasabi ng tenderness.
Okay po. Here po.
Press ko konti. Yun o. So,
Sir, I will press on the area. Breathe in. Breathe out.
ito na yung PT session. Hot compress, release, stretching and therapy.
Start with face up. Let me
Face up?
check you.
Yep.
I'm going to check those muscles that were not functioning that first day, just to see if they're still working good. Pull strong. Keep it here. Pull strong. Yeah, that's good. Pull strong. That's good. I'm going to push it down. Yeah, hold. That's good. Yeah, hold. Excellent. Okay. Those were the ones that were not working before. Maybe you just sort of strained it a bit. If you did, let me adjust it and move everything back. I think it should settle down within a day or two now.
Yeah.
So, let's see. Take a breath in. Breathe out.
Wow.
Good job. Take a breath in.
Wow.
Good job. Breath in.
Thank you, man.
Take care. All right. See you, man. Take care.
Ito na yung session namin today. Session ko pala. Sayang hindi natin nakita yung trial niya. Nagustuhan mo ba yung chiropractic?
Sarap.
Guys, it's my 7th session. So, scheduled ako for PT, for chiro and myotherapy. Mas better na yung feeling ko. Pero meron pa rin ako na-feel dito sa front at sa back.
Breath in. Breathe out.
Wow.
Nice job. And breath in. Breathe in. Chin to chest. Breathe out. Ooh.
Thank you.
He's doing great. Good to see you, man. Bye. We'll see you next time.
Done na yung chiropractic treatment. So, it's time for Mayo. So, wear ko lang muna to. Yan, so wait na lang tayo. Baka hot compress then myotherapy naman. Yan, so pumayag konting video. Pakita ko lang highlight.
Oo nga, nag-ano siya ulit shrink.
Tigas na.
Opo. Ano po nag-trigger po?
Nag-gym ako light Saturday, tapos yung stretching yung parang masyado kong tinodo. Okay naman siya. Pagising ko ng Sunday,
Yun na.
masakit na. Baka yung pagtayo ko, hindi ko sure eh.
Pero ngayon, pag nagbe-bend forward kayo, kumusta?
Mas better
Mas
siya.
better na siya.
Oo, pero may nararamdaman
May
pa ako.
Parang may ipit pa rin.
Oo. Yung Sunday, parang mahina talaga siya eh.
Pero yung sa lakad nyo, kumusta? Okay,
Okay
hindi
naman.
Parang masakit na.
Nakakalakad na. Walang pain pa baba.
Relax lang po.
Hmm.
Okay lang ba yung headrest nyo, sir? Hindi kayo masyadong naka-irritate or
Hindi naman, okay.
komportable naman.
Doon na yung Mayo session, sobrang sarap. Grabe, sobrang relax tong likod ko. 9th session ko na pala yun, so ang last session ko is on next week, sa Tuesday. Remove my shoes. Diba? Wow! Wow.
Nice to see you, ma'am.
Thank you!
Yes, nice to see you.
Done na yung Cairo. Next na naman namin is yung PT naman. So, focus tayo sa lower back ulit. Guys, done na yung hot compress. So, myofascial release na. Then, PT.
May pain, sir? Wala. Wala po. Kahit discomfort po?
Wala, pero masarap siya.
Ah, sige po. Sir, press lang po ako.
Sige lang.
Breathe in po. Breathe. Breathe in. Breathe. Dito, sir, may tenderness po ba?
Masarap siya. Pag tinitingnan, masarap.
Pero wala naman pong discomfort.
Wala.
Kaya dito po sa may taas?
Wala.
Wala po. Sige po, sir.
Done na yung Cairo session and yung PT. Sarap ng feeling, medyo mas better na ako and wala ng pain sa exercises. This will be my last session sa Intercare sa BGC. So, hopefully mapaayos ko yung mas maging maayos yung hips ko. Medyo better na ako ngayon. Yung posture ko, mas conscious na ako. Focus kami ngayon sa stretching and strengthening.
Breathe in. And breathe in. Breathe out. Breathe in. Breathe.
That's it. So, done na yung therapy ko sa Intercare. Yun yung experience. So, naka 10 sessions ako. 10 Cairo, 5 PT, tsaka 5 myotherapy. Conscious na ako sa posture ko. Mas nag-improve siya. And way better than before. Then, yung posture ko okay na. Ang suggestion nila is sa mga exercise or mga activities, dapat lang yung proper posture. Maganda doon sa Intercare. Sobrang friendly ng mga personnel nila doon. Very knowledgeable dun sa kung ano yung mga line nila. And helpful sila. If may problem kayo sa posture or may injuries kayo or may masakit sa muscles nyo, definitely i-recommend ko si Intercare. Investment na rin sa health. Hopefully maka-help sa inyo. If you like this video, don't forget to subscribe. See you on my next adventure. Peace!